Same Day Smile.
So guys, back here again. It's been another year on this journey with Avant Garde Dentistry, and what a year it's been. It's flew. Same Day Smiles. Just over a year now, we developed this concept with the idea to bring all our workflows under one roof with a simple, easy to understand concept for dentists and for patients. And we've just been reflecting on what we've actually achieved this year without actually recognising that we've done everything we set out to do, and it's just the beginning. So Jamil, it's been your first year with us with Avant Garde, even though it feels like a lifetime already.
First full year, yeah. We started a little bit beforehand, a year before that, introducing some of the systems like First Fit.
Yeah.
But yeah, first full year, flown by, and been utterly delighted with everything that's gone on in this past year. We've met some great people, amazing delegates. But more important, I'm fortunate to have been to a lot of courses all over the world, and Avant Garde is up there with organization, efficiency, quality, and just thrilled to be part of it. So thank you guys for putting on an amazing year.
Thank you for being a part of it, mate. What's next, my lad?
God, so yeah, if this year wasn't intense enough, let's just do more next year. Why not? To be fair, we have grown year on year, and I think it's just down to the hard work and down to planning. And I think what we've got planned for next year is super exciting. And what, six courses?
6 courses spread over 30 days. I think this year was 21 days, stepping up to 30 days. Yeah, and I think next year is part of the learning curve of the last 2 years of where we've recognised where our delegates lie, where maybe some of the gaps lie, and where Same Day Smile has really sort of pushed the envelope forward, and how that sort of governs what we do next, really, with the education part of Avant Garde especially. We've got this amazing concept now, which is, it's crazy to think it's already in demand from patients. It's already on patients' lips. It's on the lips of the industry, of the dentists that want to know more, want to be a part of it. And I think the biggest hindrance we have now is, our dentists and our delegates, they can't learn the systems quick enough. And I think that's what we've learned this year, because it's comprehensive dentistry. Let's not, there's no other way about it. We're simplifying the approach, but it's very comprehensive in how we plan, how we understand digital smile design, facially driven smile design, occlusion, rehabilitation, dental materials, and we can't forget that. And so hence next year we've decided to amalgamate all of our concepts into a very intense but easy to learn and adopt the principles straight away, to be fully prepared to become a 100% same day smile provider and feel fully confident. And that brings us to the residency, which is our first new course of 2024. What do you think of the concept of residency, Jamil? Because I know you know a lot about the residency programs that have been around the world in other courses, and they've all been great successes.
I mean there is a demand for the knowledge about comprehensive dentistry. I mean, we're not just focused on smile design and making people's teeth look beautiful. We all understand that patients come to us in a variety of different states, needing implants, needing gum contouring, needing comprehensive dentistry. Planning is the key there, isn't it? So, and then you're right, looking at our delegates, it's very important to have firm grounding in certain concepts like the digital smile design concept. So I think we're going to revisit that in a little bit more detail. So those guys that have been asking us, where can I learn GSD in the UK? Well, you can learn it here with us, right? So we're gonna take our time. We're gonna go through that, and then all those things that made the digital smiles design, system so accessible and so important for us in our careers, and led to same day smiles being created. We want our patients, we want our delegates to really benefit from that comprehensively.
Yeah.
And I like what you said about making things simple, because we know in dentistry there's many different ways to do different things, right? But from what works is another matter in our hands.
Yeah.
Right. And we wanted to look at all the different delegates, see what's common to everybody, and then distill it into simple procedures that anybody can do. Standardize it.
That's a big thing. We've a big message that we've achieved to get out, especially, the injection mold technique was, we've been doing that now for 3 years. That was a way to standardize composite veneers without a shadow of a doubt. Still very, very popular treatment. It brings a lot of benefits over other techniques, and now we've moved that into non-preparation veneers, which has been a huge success with the mill composite, and obviously the first fit fully guided system. Standardizing these treatments so they are easy to execute with the right planning, with the right understanding of that patient, and a full holistic approach to the planning. And that's where I think the lab has really developed as a planning center, as well as, just your everyday lab, fully digital, fully guided. And we want to give our delegates across the residency now, all of the concepts at once: digital smile design, patient journey, data acquisition, lab communication, injection mold technique, mill composite technique, first fit technique, live patient experience, all over a very intense, full immersive experience, 3 days. And that's exactly what the residency is. And I think we're going to get a lot of delegates who've been on 1 or 2 courses come back and do it again with the residency, and just go into that knowledge that little bit further, and just get that little bit of extra confidence to be able to execute these treatments day in, day out, as well as obviously a lot more new delegates, because we've trained 500 new delegates again this year. It's only getting bigger and better.
Yeah, and certainly, that repetition element is very, very important. I look back at how I learned. I was very fortunate to get into DSD, 2014, 2015. But in those first few years, I had to go and do the course a number of different times, right?
Yeah.
So, I had to travel to Istanbul, had to go to Berlin, had to go to Amsterdam, right? Different places. But now people can just come and benefit from it in Liverpool. And this is an important thing as well, isn't it? I think we're going to be coming back home.
Yeah,
back to Liverpool.
It's coming home for real this year. Yeah, like literally. So, we tried our best to make ourselves accessible as we can for the last 2 years, which has been exhausting and expensive. Mm-hmm. But the main reason of coming back to Liverpool is so that we can have these, these long days. There's no time limit on these courses. It's all about education, knowledge, building a community, having a great experience with all the delegates, and being in that clinical environment, being inside the blueprint. All these concepts are a blueprint which we've built and proven in dental excellence, over that 9,000 square foot that we have. It's proven. But we know with the launch of the licensed clinics of Same Day Smiles now, which you two are obviously part of, that we can take that blueprint and we can implement it anywhere, as long as that the dentists are fully understanding and on board with all the concepts. So having it in that environment is a massive privilege for me. It makes so much more sense for me now for what we want to do, because I think the dentists just really feel what they want to go away and take and create. And that's exactly what I got when I first did digital smile design. Christian built this lovely workflow and system which brought encouragement and motivation to dentists as well as patients, really brought the two together. And we over the years we've built those systems into dental excellence, and that is the blueprint that we're now teaching. So to have it in the facility which lives and breathes what we're talking about every single day, it makes a lot of sense to me.
I think another advantage of having the courses back at DE as well is because what we found doing the course, teaching them here or everywhere, the live patient experience part of it is so important, because you get to see it, you get to try it on, models and everything else. But then when you get to see it actually happen live in front of your face on real patients in a clinical environment, I think that really brings it home for a lot of the delegates. So the live patient day we had course, that was super popular. Now this is part of the residency too. So they really will get the full immersive experience then, because they'll get to see it actually on live patients. And I learn a lot from watching other people do stuff.
Yeah,
you can talk to me on a book as many times as you like, teach me on a model, but until I see it physically happen in front of me and I can shadow an expert doing it, I will pick up so much from just watching them. It's a key part of the learning.
We found that with the delegates that have been on the live have gone away and done more cases. So to do a day of theory, a day of hands-on, and then a day of live, you're literally going through the motions, aren't you, really, to just get more and more confident. And we are going to offer a more of a mentorship program where you can do extra cases over the shoulder, or you can even bring your patients to Dental Excellence and you do and we mentor. And they're all little extra sort of bonus things that we will be providing for our delegates. But I think the key now is those 3 intense days with the residency. If you're serious about being a same-day smile provider, and you want to be, you know, first mover advantage on this, because we're creating a big movement here, we can feel it, feel the energy. I think the residency is the place to be.
And that live patient thing that you mentioned is super important. Those are my favorite days, I think.
Yeah.
And I think the delegates as well, because, you know, not everything goes according to plan. And sometimes you learn more from mistakes that happen or things that are just thrown up, you know, that you didn't expect.
Yeah.
And then how we deal with it, because we come from different backgrounds, you know, different dental schools, and we deal with things in different ways. So when you're seeing problems solved in real time, this makes everything easy for you when you go back to your clinics.
Absolutely. Absolutely. There's never a perfect day, is there? Let's be honest. So, you know, to do 3 live patients back to back in a normal working day, sometimes we've done 60 units.
Yeah.
You know, seeing is
unbelievable.
Believing. Seeing is believing. You know, it's speed and efficiency at its finest. And that's what makes, hopefully, it more accessible for patients, because with that efficiency and predictability, we can make more affordable solutions for patients as well, which is an important thing with what their other options are now and the choices they're making. I think we need to make efficient, affordable, accessible solutions for our patients, and that's a big part of what Same Day Smile is all about.
Yeah, and it's important, you know, no limitation to time, right? Because in many places we go and we deliver courses, you have to be out at a certain point, right? But if anybody's been to a Dental Excellence course at an Avant Garde course in Liverpool, they'll know that, you know, it's not 9 to 5.
Yeah.
We're there for as long as it takes to get the job done.
Yeah.
Right.
Exactly.
And to explain everything and get questions answered. And, you know, many times, I've been at courses there, then it's finishing at 6, 7, 8 o'clock at night.
Yeah.
Right. Which is the way it should be.
Yeah.
Because we're all passionate about dentistry and we want to make sure that everybody gets as much as they can from these courses.
Absolutely. This is going to be 3 days, the residency, and it's going to run from 9 a.m. to 8 p.m. at least.
Yeah.
3 days. Which should be a fantastic experience, building a community, and we want to mentor our delegates after as well through the lab and through our groups and stuff like that. So the key now is really instilling confidence, because we have the Same Day Smile brand. It's out there, it's in demand, and we want to make it accessible for dentists and patients. And that means we need more licensed clinics like what you guys have. It's early days, but we're launched, we're live. What do you think about your experience with that so far?
Yeah, so far it's been a pleasure being a licensed clinic of Same Day Smile officially, right? So obviously I've been doing the treatments for a while, but yeah, it's really good. Having new patients coming in that are really seeking this stuff, really wanting this type of treatment, and knowing the Same Day Smile term is so beautiful when they come in and they say that to me, because it means it's starting to really register now in the public domain. You know, within our industry, people know it, but then to see the general public using that terminology back to you, that's when you know your brand is really getting established. So it's so nice they're coming, and the cases are great. And it is a fully comprehensive, you know, patient database that I'm seeing now coming in through that, and it's great. It's bringing, you know, it takes you a bit out of your kind of potentially mundane stuff, and my brain's starting to work again, and it's nice. It's bringing some excitement back. I mean, I'm treatment planning again. I'm thinking, oh, this is exciting.
Yeah.
And for me, that communication part is always so nice with patients when I've never met them before, and I can take somebody that comes in that might be nervous, won't know what they want to do, have an idea of what they want it to look like, but they know what the destination is, but they don't know what the journey is. And for me to map out that journey for them and present it to them and wow them with what we can do, and then they see the digital aspect of it, which they may not have known before as well, and like, oh my gosh, this is not how dentistry was, this is not what I expected it to be. So you're just raising their expectations all the time, and then, you know, with the predictable workflows, you can smash the result out of the park. It's exciting again being involved doing this type of stuff. So yeah, I'm loving it so far, man. It's been really good.
Yeah. How are you going with yours, Jamil?
Yeah, same thing. You know, it's great to have just this one additional thing in our practice. You know, we do a lot of marketing anyway, and we have our own patient database. But to have live patients, good quality leads dropped into our books by Avant Garde directly, by Dental Excellence directly, by the Same Day Smile team, you know, this is worth its weight in gold, because, you know, patients ready to go ahead with treatment. And actually, the thing that I was most impressed about is how well organized everything is. Rob and Ollie came up and did the onboarding with us. took the videos, got great patient testimonials. It was a great day.
Yeah.
You know, our patients loved it as well.
Got some great content from that day.
Yeah, and I thought it was going to be much more difficult, but it just flowed so naturally.
Yeah.
But that comes again with the whole concept that you guys have built from the beginning to make things quality. You know, to make things efficient, all the things that we didn't like about working with specific organizations, all the difficult things. You know, I haven't found this yet with Avant Garde, and long may it continue that the quality.
It will, certainly it will. So course number 2 then, we've obviously spoken about the residency, probably is our showcase, but there's many others. So number 2, we have what we're calling the digital therapist, because what we realized with the residency being so intense, so comprehensive, all the workflows, a lot of them are about indirect, comprehensive treatment planning, not necessary for a therapist, and we don't want to lose the therapist. I think therapists should be liberated as much as possible in everybody's business. They have a great role to play, almost as a little partner to the dentist. You know, my therapist, they do the mock-ups, they do the injection mold technique, they stabilize the patients. So they're a big part of this 1, 2, 3 journey. So we don't want the therapist to miss out. So the digital therapist program is a 1-day course. It's essentially the injection mold technique course. So dentists can come on it too if they just want to learn that startup, you know, initiation, learn a bit about digital dentistry, learn the injection mold technique, but all of the data acquisition, digital photography, intraoral scanning, and of course the execution of the technique, the lab communication, it's all there. So it's a great course for therapists. We want to focus it on therapists and get more therapists on board because, as I say, they're great practice builders, absolutely. And they can really enjoy what they do, and the principles should really sort of help them flourish. But dentists can attend as well. So that's probably almost a course that we've already nailed over the last couple of years, and we want to continue to do that. What do you think about having therapists in practice and send them on this course?
Super important. You know, we work as a team. Therapists are super important, and you know, it's really important for us as well to actually not just have dentists teaching the course, but actually have therapists taking the lead, like Emily.
Yeah.
You know, she's an amazing clinician. Quality of the work is outstanding, and a great educator as well. So anybody can do it, right? This is what we want to say, that any part of your team, whether it's associates, whether therapists, they can be involved in cosmetic dentistry, good digital dentistry based on sound evidence.
Yeah.
You know, accurate, predictable, efficient, all the good things that we love about digital dentistry. Now accessible to the whole dental team.
And I think it brings a nice new string to their bow as well, right? And it gives them a higher level of job satisfaction and doing something new, something different, pushing their skills as well, their clinical skills, and actually coming away from what traditionally we think therapists are doing, which are there to stabilize patients, do some hygiene, treat the kids. You can make big differences to people's life now and come and do some amazing smile makeovers for them, right? And the few therapists that I've kind of helped and worked with and mentored a little bit doing this, they're smashing it.
Yeah, we've seen some amazing skill sets come through from our course in therapist sort of arena, and it is amazing to see. Really is.
I think some people can get put off by the fact that it's maybe, you know, I'm coming to learn something from a dentist or dentist only. Whereas, you know, the fact that we do have therapists that are doing this every single day and are leading the courses on it, it just goes to make things a little bit more easier to take on.
And that's why on the live patient day, you know, with all respect to all courses, sometimes you'll get a course and one person teaches the course and they do something exceptionally well, credit to them. But we're the complete opposite of that. On our courses, we have therapists, we have some of my associate dentists, previous delegates that have been on a program, teaching, doing a hands-on, doing the live patients. So every single case is done in the same level of quality in somebody else's hands. And I think that's an important part, because we're talking about scalability of quality here, which is a very, very hard thing to achieve. And unless we're proving it, and the proof's in the pudding.
It's the holy grail. You can talk as much as you want about digital dentistry, or good quality dentistry, but if it's not scalable, then you're only the one that's limited doing it.
Exactly.
And nobody else benefits.
Yeah, exactly. And it's probably the hardest thing to get right, and we're getting so close now, and it's great to see more and more people execute great results. So course number 3 then, same day smile sprint. This is an exciting one. We tested it a couple of months ago. We didn't do things in half. We did 24 units in one day. And this is the same workflow, the 1-2-3 approach, comprehensive treatment plan, mock-up for the patient, and then execution. So on this course, our advice is to do the consultation, do the mock-up, sign off and approve, customize with the patients, and then book in that sprint day with the patient where you can prep guided if you need to, semi-guided or no prep, whatever it is, but you book that time slot in with the lab and you have a live final design with the lab, which is fantastic. You know, it's digital at its finest, isn't it? We send the files directly to your Sprint Ray 3D printer. You fabricate on site, an hour, 90 minutes max, and they can go inserted on the same day in the patient's mouth. Beautiful workflow. On the course, we do the 3 stages in one day. Data acquisition, mock-up, final design, prep, execution. So it's an intense day, but again, seeing is believing. You know, we can do it that way. When you break it down over 3 stages, it should become part of your everyday dentistry. How to introduce 3D printing, chairside dentistry, chairside workflows into your everyday dentistry. And I think, you know, we're proud to offer that at Avant Garde. We're proud to offer that at the lab. I think the CAD design is still the most important. It's where the magic is. We're not asking dentists to be CAD designers. Put the trust in the lab, communicate, and then you'll receive ready-made files to basically print and finish.
Yeah.
Combine that with the Cano course that we've got in January, and you know, what have you got there? You've got the opportunity to create beautiful indirect restorations that are going to last a very long time with characterization, 3D staining, chairside within a couple of hours. It's mind-blowing.
Yeah, I mean, all the chatter happening in the dental community, different countries of the world, is about 3D printing.
Yeah.
Right? This is really the revolution that has started, is ongoing, and will change the face of dentistry, right? I mean, if we thought that milling was important and gave great restorations, wait till you see what digital will do and 3D printing will do, right? So just the materials improving all the time, having amazing partners like Sprint Ray with great printers, and printing technology makes things easier and quicker. So yeah, it's an exciting course, isn't it?
Yeah, very much so. Really is cutting edge at its finest. And that's a 1-day course, but it's another intense one, really intense. Great course.
Yeah, I haven't seen anybody doing 24 units in a day, right? So, like you say, we put our money where our mouth is.
Yeah. We don't do things by half, certainly. Yeah. And then the next one, this is a very exciting one for me. And I do want to spend some time to touch on this because the concept that I have in my mind about this 2-day course, the ultimate patient experience course, and you heard me say this in our teaching, appointment 1 and appointment 2 is where the magic happens. The execution appointment, stabilization, whatever comes after that. Appointment 1, appointment 2 is where we really win our patients over. They leave motivated, educated, treatment plan is signed, sealed and delivered, and away we go. But the ultimate patient experience course is about that whole journey to that point. And I talk often about how little kinks in your chain, who's got often nothing to do with the dentist, who answers the phone, who's managing your social media accounts, how you're creating your leads, what you're doing with your leads, what happens when you first enter your building, and then obviously ultimately the consultation process. How is it executed? How streamlined is it? Who is involved? Who is your nurse? Are they digitally trained? Can they scan? Can they take photographs? What do you ask the patient? How do you communicate with the patient? Do they visualize their problems? How do you co-diagnose? That is all what we're talking about, the patient's ultimate patient experience. And that's why it's a 2-day course. We did some marketing courses a couple of years back, which were well taken. And it's going to start with that marketing lead gen, but with the focus on the patients, the messaging, the consistency of the messaging for the patients. Because every time you send the right message to the patient, then their expectation gets a little bit higher. And it takes one person to drop the ball. So we either exceed expectations or we don't meet expectations. There's not really any in between. And it's something that we've managed to do very well within the Blueprint of Dental Excellence. And we want to teach this. So this course is for dentists and their head nurse, treatment coordinator to come together. So this is a dual ticket course. You buy a ticket, but it's for 2 people to attend over 2 days. Another very intense course. And this course is going to finish with another live experience with a twist. It's almost going to be a little bit of a theatre in dental excellence. And the delegates are going to act out different scenarios of that consultation process, and we will have different scenarios set up, almost like your communication skills lectures back in the day in uni.
Role play,
that's the one, and see if we can get that consultation nailed down, in the partnership that we want you to take back immediately to your clinic and replicate day in, day out. So this is really exciting for me, because I think it's going to be a really unique, really exciting course, and I think the delegates will leave this course with that extra edge. I think if you come on the residency and you come on that course and you bring the best team member possible, I think you're ready to be a licensed clinic at that point, and we can put full faith in our licensed clinics at that point, because I know how much quality you're going to get from those 5 days.
Yeah, I know. There's a lot of support staff that say, oh, the dentist was at a course and he's come back on the Monday morning and he's wanting to implement all these things, but we don't have any clue about how to manage it.
Yeah.
So this is ideal, isn't it?
Yeah.
And having an expert like Milad in social media and dealing with patients and communication is a real important part for this.
It's going to be really good course, I think, and unique. I think it's going to be unique.
And also I want to say, all three of us bring something amazing to that whole journey along every step. So I think that's where the unique element comes into it, because you get the gurus that do one thing and then you go see them one day and then you get someone else that does one thing. But to have, I think, all of us doing our bit in an environment as well, like where you can really visualize that workflow and you can take that and bring it, because my clinic is totally different to yours, but I can still offer an amazing experience for patients to come in my area and with my team. So it's going to be, you're going to take everything from that and be able to implement it with your team in your environment, and we're there to support you doing it. So I think with all of us, you're going to get something amazing.
I think you just grasp the flow, and especially when you bring a team member in, it just clicks, doesn't it? And then you understand the concept of what we're trying to develop, and how important the key team members are, how important it is to dedicate that time for consultations only. It can't be in between an exam and a root canal or anything else. It has to be dedicated time, and it really does get super high conversion rate, and it's seamless. So that's going to be an exciting one, and it's another brand new course that we haven't done before, which is going to be exciting. So where are we up to now? That's number 4. So we're now 5 and 6. So we have the guided surgery course. That's guided perio, gum recontouring, crown lengthening. That's non-surgical with a special Palocano piezo tip, which has great results, quick healing, and obviously conventional techniques as well. How to communicate through facially driven digital smile design and communicate that to your periodontist, your implantologist, and get the same results, all driven by the initial design through guided surgery, guided techniques, which we can help you and guide you with through the lab. This is an exciting one as well, Jamil. It's been coming. People have been asking for this.
That's what I was going to say. People have been asking about it a lot, right? And it's one of these things that I think that people, is mystified. People think it's very difficult to do, and it's not.
Yeah.
As long as you have a sound basis of the about biology and what's actually happening and what we're trying to do. So we'll cover the theory parts of it.
Yeah.
And then practically try it out, the techniques that work, whether it's laser, whether it's the canopy, whether it's the blade, right? So we'll be teaching all these techniques.
Yep.
And Craig's an amazing technician. An amazing clinician. He'll be involved with this as well. I mean, the amount of knowledge this guy has is unbelievable, right?
Yeah.
I always see him on the WhatsApp group giving great advice.
Yeah.
So and I think he's somebody that's taken your philosophy, your training, your techniques, and really implemented it really well.
Yeah, definitely.
So we're gonna have an incredible person involved in this, and then with the implant work that he's doing, and the work that we were doing with Dentsply Sirona MIS, probably the best guides that I've seen, surgical guides that I've seen for implantology, having that aspect of it in the second half of the day. So not only are you going to get to see gum contouring and crown lengthening techniques and learn about that and practically be ready to do it, because it's a straightforward procedure to do as long as you've planned things properly.
And it's so common in smile design. Like we were talking about this before. There's no perfect case. The amount of times we'll collect the data, we'll analyze the patient's smile, and we need to change a zenith position here. Then there's a missing tooth there. We want the implant to be positioned in the right place. These things are every day, and it has to be start with the end in mind, driven the right way. And a lot of dentists, what we're finding is they get into that mock-up, and we know what looked right, and then there's a couple of different disciplines in there that they're not quite confident with. So we know we want to instill that confidence in the general clinicians, but then at the very least allow them to control the outcome when they delegate that to the perio or the implant specialist and guide it their way or our way, the way we're teaching, and then you'll get the outcome that the patient deserves or is promised in a very efficient way. So,
I don't think there's a case that I do that doesn't involve some degree of gum contouring.
Yeah.
Right? To make things look exceptional, you really need to be able to, as you said, control the tissue, get tissue healthy first and foremost,
yep.
and then be able to design. It's just as important as designing the teeth is designing the structure of the gums, isn't it? And the shape of the gums.
Absolutely. We all look at like those two centrals and you think, what is it? And often it's just the gum. That symmetry is just as important as what's happening at the incisal ledge. And we instill this all the time in our courses, and that's why we always get the question, what laser do you use? How do we contour the gum? Is it difficult? And it's just like, we're going to make it easy for you, like everything else. Next course, there's one left.
Strike a pose.
Photography is important because it's the starting point of everything that we do. Just as important as doing the intraoral scan correctly.
Yeah.
Right? Or it's very important to get amazing photographs that in the correct angulations and consistently again and again.
Yeah.
And not just for the dentist, but for the support staff who are going to be, the TCOs who will maybe be taking the photographs for. So Harrison's great photographer. The course has been running for a little bit of time now already. Has great feedback on it.
Amazing feedback.
And to be able to learn from a master like Harrison and basically have everything in one place. It's a great course to come through.
Yeah, it's all protocol, and photography is the start and the end, essentially, because when you get these beautiful results, you want to be able to showcase them, right? And the photograph can be really let your results down if you don't quite capture it right. At Dental Excellence, again, the protocol is we have all the series of photographs on the wall in the imaging room, and every single nurse can hit that standard of photograph. And we take them before, we take them at mock-up, we take them at provisional, we take them at final. And it's consistency right along. So then when the marketing team want to come into play and take those images or the videos and create, it's consistently across the board. And we get our delegates to do that, or our license clinic to do that. One of our promises is that our marketing team can create all your before and afters for you. They just have to be there on the portal.
Which is great value.
Which is amazing. Great value, yeah. So very important course. And like you said, I think it's a course, whoever's going to be taking the photographs, send them on the course. Mm-hmm. So whether it's the TCO, the dentist, the nurse, even all three, definitely a course to attend.
Yeah, and I think, photography can be used for planning. It can be used for, great after shots, as you mentioned. So art photography. So there's different aspects that people will learn on this particular course. It's not just going to be limited to technical photography, but how to create beautiful, exceptional photos that will be amazing for your marketing as well.
Yeah, definitely. So that's the sort of, each individual course wrapped up and explained. So in a nutshell, what are the USPs of the Same Day Smile courses? Why choose us?
Wow, there's so many USPs, man. It's difficult. I think it's really the fact that we are looking at what you're going to be doing and giving you all the skills from the very start to the very end to be able to accomplish that, right? It's not just one element of it. It's not just this for you only, Mr. Dentist. We're covering the whole thing, the team, the communication, the planning, the execution,
with the patient in mind at all times.
With the patient, exactly. That's what I mean. The end goal is always why we're doing it. And we're giving you, for me, the USPs within the whole thing we've put together, all of these courses, they're all interlinked and they're all there to give you every single piece of skill that you would need as a dentist to level up and be able to carry out these treatments with predictability and beautiful results every single time. So really, when you come on this whole journey, you're going to be equipped fully to do this type of treatment in your clinic. And that for me is the USP, because we're not leaving really anything out. We're covering everything on this.
Yeah. And we know, which we'll come to in a little bit, that we know that these cases are in demand because people are demanding them and traveling halfway across the world for them and making often poor choices. But we'll come to that. Let's stay on the USPs, and then I think that's a big point that we need to mention.
Mm-hmm. How about you, Fuji?
For me, it's simple, predictable workflows, right? At the end of the day, we want to do dentistry. That's really the bread and butter of the reason that we go into courses. We don't just do courses just to learn something and not put into practice. So anything that makes it simpler without sacrificing quality increases efficiency, makes things more predictable, takes the headache out of, what am I going to get back from the lab?
Yeah.
Right? What you've promised the patient at the beginning, you're going to be able to deliver. This is gold. I mean, I look at the first part of my career when I was, hoping that the restorations were going to be good, right? Because maybe the lab maybe didn't give the same shape or color that I was wanting, right? And the thing that I hated the most, right, before I took on digital dentistry was the fact that patients would come up and say, I preferred your temps. Yeah. Right? So there was a disconnect in communication, and I'm sure everybody's faced that in their career. So anything we can do to make it simpler.
And those things again, putting our money where the mouth is. 2 big points that I ask my marketing team to push hard as proof of concept in our marketing is show us replication of mock-up or temps to final. Show it, okay? Because we know how well we do it, yeah? Which gives the patient the ultimate control and customization, yeah? And show us your preps. We all hear minimal prep. Oh, did this beautiful case with minimal prep. Okay, so let's start showing our preps. Let's show the patient the preps, because when the patient realizes what a real minimal conservative prep is versus a non-minimal conservative prep, and what is a minimal prep, how can we control that? With our systems, we can control that. So, another thing, like we do the live patients and whatever else, in our markup material and the way we're showcasing our courses, we want to show that we can replicate a mock-up or a provisional in a predictable way, like for like, copy and paste dentistry, which gives the patient control and customization, often with no prep techniques. And when we do prep, we'll show you our preps. Yeah, there's nothing to hide.
You know what I like when you show them the prep and they go, "What have you done?" Yeah. Like, I've actually done a lot by doing not much.
Yeah.
You know what I mean? And that's nice. That's nice when they don't even know, because they're expecting that little tiny stump.
Yeah.
And when they're not going to get that, and they're going to get nowhere near that.
There's no shark teeth here, bro.
No shark teeth here, man. Definitely not. I've got another USB as well. Actually, for me, a USB is where we're doing it. The location, man. Because Dental Excellence is a very unique place, and bringing the delegates back to that environment to teach them all this stuff, it's for me a USB, because when you walk in, you just get into a vibe, and everybody says it. Being in that place, you walk into it and you're just ready. You're just kind of, you feel a bit different, and you're ready to kind of absorb all this stuff that we're telling them, because it's in the place where it's all been proved, tried and tested. And the beauty is we've got a lecture theatre, we've got clinical spaces. There's a lab. The lab that is going to be working with you, the people that are going to be working in the lab are there. You can go across and see that flow.
And not a small lab either.
No, it's top, a proper lab.
Stuff. Yeah.
And that for me is a USB, because when you're there and you're seeing it, and then you see the patient experience part of it in the chairs, and you're starting to connect all the dots of what you've learned previously, and it's just that whole environment, man. And you're going to be there for 3 days. Right, so when you're really absorbing this, it just G's you up, ready to go, and then implement all those bits into your own clinic and into your own journey. So that for me is also a massive USB, because every time, I've been there a lot of times now, and every time when I leave, I get G'd up again. I'm looking forward to coming there once a month, every month for the next year.
When I walk into that building every single day, it's stress. I often am the last to leave that building, and even now, this is a little secret. Before the lights go out, when I'm in there on my own, I'll do a lap of the building and I'll walk around and just take it all in, because it has that special aura when you just take it in and you just stop in the madness of my crazy day. When you just stop and it's all slow and I just take it all in, or even go upstairs in the lab and you just feel accomplished or motivated and ready. It just has that effect, doesn't it?
That's what I mean, and that's why it is a USB, man. Yeah. Because coming there, and for people to come that haven't been there and haven't seen it, you'll always take something away from it.
Yeah, absolutely.
There's no doubt it's a special place.
Yeah. And there's one more special USP for me. As always, we have a superstar DJ.
Yeah, so that's the other. We want to, obviously, we know these 3 days are going to be intense for the delegates, right? They're going to be learning a lot. It's going to be, so we need to have some downtime too, right? And again, that's what's beautiful about the venue, right? So I think first night we'll probably keep it indoors. We'll bring some food in, get some drinks in, and people can unwind a little bit after the first intense day. And then, but we also want to be mindful though, they're coming back for day number 2. right? So day number 2 is done, and I think we'll put on a little shindig for them day number 2, man. I'll get the decks out, spin some tunes, gosh. I guess get some food, because that networking part of it as well is also super important, because bear in mind, we're all in, you know, all the delegates are going to be in the same part, right? They're going to be on that same journey together. So keeping in touch, having that support network afterwards with us in the WhatsApp groups, in the Facebook groups, so that you're starting to kind of be with like-minded people, your peers really will start to develop from that. And, you know, creating that networking part, that kind of downtime for them as well is super important.
And it's a really positive group, isn't it?
Yeah, man,
really
always everybody, because you know, they're all like-minded people, right? Everyone's coming in there to learn this and excel in what they're doing and take the patients and ultimately improve this for patients. That's what comes down to the core of what we're doing, right? We want the patient experience to be better. That's what all of us are always about, changing the face of dentistry, taking people from thinking dentistry is something horrible, painful, you know, a traumatic experience, to being something completely different. The comments we get, like I said about the prep, oh, is that it? That didn't even hurt. I'm doing a lot of my work even without anesthetic majority of the time, because it's just not necessary if you're prepping properly, right? So we're changing the way people are viewing dentists and dentistry, and at the end of it, they're leaving with that smile that they wanted. So the dentists that are coming on this, the delegates that are coming on, the therapists that are coming on these courses, they're of that mindset, and they're ready to implement this stuff in there. So it's just always a good group of people, always. And you know, we wanna make sure they're having a good time while they're there with us, man. Especially over 3 days, man, because it's gonna be intense, but it's gonna be a lot of fun.
Yeah, work hard, play hard. Definitely.
So over the last couple of years with our courses, we've been very lucky to work with some fantastic brands, as obviously as sponsors, but they're also brands that we're using, right? They're people that we are every day using. That's why we've decided to partner up with them and bring them in, and that's going to obviously continue next year with all the courses, and we have another exciting lineup of people that are supporting us again, which was, you know, always very privileged to work with these guys. So first and foremost, we have Ivoclar, a big supporter of us, and I'm a massive fan of Ivoclar. I use everything Ivoclar, like literally.
Same with me.
All my composites, all my bond, everything I use is from them. So we're really lucky to be working with them again this year, or next year, I should say. And yeah, fantastic products, right?
Amazing products. The best.
Yeah. We're literally Ivoclar end to end.
Everything.
We're even using the Miller machines now, like literally as much as we possibly can, because it just makes things predictable, right? All part of that predictable sort of ethos.
The same family.
Yeah.
100 makes sense. And then we have
Align Technology and their systems. You know, they had a big understand their driving force is end-to-end solutions. So, you know, there's a lot of synergies in what Align are doing and what we're doing, and makes a lot of sense to partner with a fantastic company like Align, because they've got systems which, you know, everybody should be using. You know, fantastic technology in the iTero scanner, not just the scanning hardware technology itself, but also the software that comes with it, how you utilize the scanner, how you use simulations, obviously the photography application, the Invisalign, Doctor Sight, the ClinCheck, Smile Architect, which is still going to be a big part of our program. So, you know, we had Smile Architect days this year. We're going to be teaching Smile Architect again on the residency next year. We're going to be touching on how to use the iTero system on the digital therapy course, on the residency, on the patient experience course, and how to integrate all of these technologies into that experience smoothly and efficiently. I think it's a big part, and you know, Align have all those systems in place, and it fits perfectly into our workflows, right through into Exocad. You know, smile design, treatment planning. We're big fans of all of those systems, and we're working closely now to integrate and embed them into the same day smile workflow even more. So going to be a big partner for us next year. Another partner, as we know, SprintRay. For me, the most forward-thinking, the most innovative, the most committed 3D printing company in dentistry, without a shadow of a doubt. You know, the speed and momentum that company is moving at reminds me of us. So why not work with them? You know, for me, obviously, we all know how great of a printer they have. I think that's only going to continue to get better. But for me, it's the resin development, the R&D, the product development, its use, the cloud, you know, the communication systems.
That's a game changer.
Introduction
the cloud,
AI, everything. It allows us to go end to end with dentists anywhere in the world and drop files into your printer. It makes perfect sense. So they're obviously going to be an amazing partner with us. I'm really excited for what they continue to bring to the industry, and we want to be at the forefront of that, absolutely. So that's 3 big partners. We've got a new partner this year, Dentsply Sirona and the MIS implant system. You're a big fan of the system, so am I, Jamil, as well. So that's
definitely the best digital guide that I've seen. I mean, there's open guides, closed guides, there's tissue-borne, tooth-supported, but just their guide is beautiful. The system is great, and the implant system as well. Has amazing dentists all over the world, like Nitsan Pachacho, Eric Van Doren, Florent Coffard. Yeah. These are all implant systems, MIS that they use on a day-to-day basis. So, bringing that into dental excellence is going to be amazing too.
Yeah, absolutely. Then we have, other systems like QuickLace. Again, been a long-standing partner of ours. It's, the most easy soft tissue laser. I'm a big fan. So they're going to be supporting our guided courses, for gum recontouring, hands-on. Great partner to have. Then we have Bryant Dental, the injection mold technique. We're using heated composite resin. There's no better heater out there. That's why we only want to work with the best. They've been great supporters of our techniques and our courses for many years now. So long may that continue as well. Who else do we have? We have GC, again, a new partner this year. And they're going to be assisting us with our chairside workflow for Sprint Ray, stain and glaze, polishing systems as well for our 3D printed solutions. And then we're talking about digital systems and digital workflows. We can't forget about FreeShape. They've been, again, a great long-term supporter of us. Their restorative workflows from scanning right through to smile design end to end has always been fantastic. And their recent, official partnership with Sprint Ray, they've created a beautiful end-to-end workflow where you can scan and send models or AI crown designs directly to the printer, which again is another game changer. So we're going to be collaborating again with FreeShape. They'll be involved again in the 3D printing sprint, same day smile sprint, so we can talk about how those systems really integrate together. Fantastic intraoral scanner, fantastic smile design software, great simulation software for smile design, for dynamic articulation, all the things that come embedded in the Trios. I think fantastic systems, so they're going to continue to be a partner of ours as well.
And yeah, if you're going to make patients look good, you got to look good yourself. So we're grateful to be working with Mediform again, making everyone feel fantastic, so they can do fantastic
Shout out
work.
Mediform, redressing the scrubs game.
Great quality scrubs.
Great quality scrubs, and it's all about perceptions, right? We're trying to change perceptions of dentistry, and that comes with how you look and feel, and patients recognize these things, and whether it's consciously or subconsciously, they just know something looks and feels different for the better. And Mediform, there's no better scrub out there for comfort and style.
Because it looks like a scrub, but it also looks as great casual wear. So you're hitting both ways.
Absolutely.
Well, utilizing the world's best 3D scanner, facial scanner. We've tried lots of them out, but the Ray Face just blew me away, man. To be able to integrate all the different STLs, the CBCT, just seamless. In a snap, seamless, is a game changer. So to have the first one in the UK at Dental Excellence, and it's something really to be wowed about. It's
super advanced, so advanced that some still can't see the true benefit of investing in such a piece of equipment. But we're talking about 3D dentistry, digital dentistry. We need that full 3D face scan to really get that accuracy to the highest possible level, and that's what it brings. We know all the softwares of merging STLs, we know they do it well, but it still microns out. And this just takes that problem away, because it merges the STLs to the most sort of detail possible for the design team to then crack on and work. And that's in CBCTs as well. CBCTs, STLs of the intraoral scan, full face scan. So we can then start looking at dynamic occlusions, throw in modular or other, digital occlusion systems in there. And you really have a full digital plan, the patient's head in front of your laptop to get planning. So we can't really go wrong. The additional benefits of working with all these great companies and great product support and great partners is Avant Garde. We have our online shop, and we are available to supply these at competitive prices, often with discounts, whether it's FreeShape intraoral scanner, 3D printers from Sprint Ray, QuickLace, We've got them online shop, so all of our delegates can benefit from those extra discounts where available. So we want to provide you with all the solutions, all the equipment, all the answers, and simplify your dentistry from lead generation to execution and the marketing afterwards. You know, what more do you want? So it's going to be a very, very exciting 2024, guys, and I'm privileged to have you both with me for one more year. And many more to come.
Be involved, absolutely.
Yeah. So we're doing all these things. We're talking about efficiency, simplicity, predictability, standardizing workflows, standardizing quality. Why are we doing this? Essentially, you know, the end goal is the patient, right? Is to improve their outcomes, to make things more predictable for them, and more long lasting, and help them make better decisions for the long term. So that's what Same Day Smile is all about. It's about bringing it efficiency and easy to understand protocol for dentists, but also an easy to understand accessible solution for patients. So now that we've trained so many dentists and we continue to do so, now our next goal is to bring these smile makeovers and the accessibility to these smile makeovers to our patients, and that comes with mass awareness campaigns, which is a big part of our Same Day Smile program for 2024. You know, we've got our organic lead generation building, we've got our marketing team working hard behind the scenes, word is getting out there. But what are the USPs? You know, why do we believe patients need these solutions? What's the psychology behind their buy-in journey, essentially, for the smile makeover? The flying to places like Turkey for smile makeovers, it's no secret, okay? We're not here to complain about it. We take full accountability for patients making sometimes poor decisions, because our awareness, our education, and the consistency of our messaging hasn't been accurate enough for a very long time. And that's what Same Day Smile is all about, when we're thinking about a consumer-facing product, which we now have. So what are the USPs for the patient mill about Same Day Smile?
I think the first thing is that consistency, right? Because like you just said, that a lot of that problem that has been created for patients is just the fact that you can see one person in one area and see someone else in a completely different area and be told two different things at two different price points with two different treatments completely, which is trying to give you the same end goal. But with what we're doing and with the Same Day Smile network of clinicians, whether you see me or you see you or you see Jamil, hopefully you're going to get the same thing at the same price, carried out in the same way.
Or at least the same options and choices.
Same options,
with the same message of pros and cons. Give people choice for the right reasons. Yeah. Choice when there's choice, and no choice when there's no choice.
Yeah, exactly. So that I think is the first time something like this has really been done, which is, you know, being kind of controlled and shown to patients that it is standardized, because we know we can deliver what we say we're going to deliver, and it doesn't really matter who you see, because we're all going to serve you and you're all going to receive that same end goal. Yeah. Right? You're going to get to that destination. So that for me is one of the first unique things that we're really doing, because it's the first brand that can actually kind of promise that, because it's based on predictable workflows. Yeah.
And when patients go to Turkey, okay, I know this for a fact, because I see patients questioning to go to Turkey every single day. Yeah, okay, every single day. Yeah. And most of the time, their decision is based on very simple, easy to understand concept. I'm going to get 24 crowns for £4,000 and I'll have them done in a week. Okay, how much? How many? How long will it take? That's literally how they think. Okay, now we need to overcome that psychological barrier first and answer those questions as quickly and as easily as we can, to then make them accessible to us, to then educate and motivate with the right fashion. If we don't overcomplicate those answers, we're forcing them away to make more simple choices. That's what we're trying to do, you know, make things accessible and understand sometimes barriers cost, okay? And it's also a cost for us, for dentists, you know, to do things right in the UK, it costs a lot more to do things right in places like Turkey. However, if we can improve our chair time efficiency and not raise lab bills or cost of anything else, then surely we can bring our costs down to a more competitive price at least, and that's part of our program. And the big part of Same Day Smile, with everybody adopting and standardizing what we do, we're not competing with each other, we're competing with the problem. Okay, we have a solution to the problem, and part of that is what I call, this movement is what I call it, when it happens, the pivot as well. I keep saying that this is going to be the pivotal moment for UK dentistry, when people click and understand, if there's enough of us doing it right to the same standard with the same message, the same consistency, I honestly believe that group, that community will dominate and monopolize the UK cosmetic dentistry market with an easy to understand product, which will be Same Day Smile. And then we go international.
Yeah, I mean, we have to admit that there is a problem, right?
Yeah.
I mean, every dentist you speak to will say, I can't believe that I saw this particular patient with such a young patient getting the teeth absolutely destroyed, obliterated. And, you know, we're thinking about, you know, we have to think about them not 1 year down the line or 2 years down the line, but for the rest of their life.
Yeah.
Right? So what's going to happen to your teeth in 10 years' time? What's going to happen to your teeth in 15 years' time? So don't make the incorrect decision now just based on money.
Yeah.
And you're right, it's our fault because we didn't explain it correctly.
Yeah.
And all it required was education and motivation. Now we know we've got the motivation right through the Same Day Smile concept, right?
Yeah.
We can show you what your teeth are going to be like. We can give amazing smile makeovers that are ideally fitted for you. But the education, you know, that's really been sorely lacking. And that's why, you know, all the things that we're doing here, all the marketing campaigns that we're doing, the treatment options, simplifying things so much is for the benefit of the patient, that don't make silly decisions that's going to cost you in the long term.
Yeah, it's a journey for the patient.
Yeah.
It's simplifying the journey, and the way we've developed it, understanding the psychology of that patient and those decisions, is we start with a very easy to understand concept just to open the doors to accessibility. Then the education becomes easier as we motivate and they understand what the possibilities are. We don't quite often get that chance because the barriers are up far too soon, and that's why our messaging is so simple. You know, from a marketing perspective, it is really simple, but it's going to allow us to educate our patients better as we open our doors to them and understand the psychology of the patients and what they're looking for. It's listening to them first and then responding with education. And I think we try to sometimes force the issue on the patients before we actually understand what they need. What is their budget? What are they looking for? You know, when is the deadline they needed to be done by? Why are they making this decision now? And why are they thinking about going to Turkey? If we can address those questions head on very early in the journey, I think, you know, we're converting patients all the time now, and this has to be a movement, definitely.
Yeah, we're not just singling out Turkey. I mean, we talk about any place for dental tourism, right?
Absolutely.
You know, we want patients to get treated ethically wherever they're going to be.
Yeah.
You know, many of my friends in Turkey are amazing dentists, but they charge similar to what we have here.
Unfortunately for Turkey, Turkey Teeth has become a brand. And it's actually become a brand in a positive way for them, because people will go anywhere in Turkey to get the teeth done because it just represents now, unfortunately.
Because they're amazing dentists in Turkey.
Yeah.
Incredible dentists in Turkey.
Absolutely.
But they charge the same as we do here in the UK.
Exactly.
And that's something to understand. Why?
Yeah, absolutely. So for patients then, USPs of Same Day Smile. We've gone a little bit back into the dental community to try and understand why we're doing it, the way we're doing it. So let's just go back for patients now. What are the USPs of embarking on a Same Day Smile journey? Where do we start?
The first place is an amazing smile makeover. That's going to be, you know, exactly the smile that you dreamed of. Planned by experts with you, customized with you, and giving you choice, right? So if your budget is a certain amount, then you can start the entry point, which is composite bonding, right, through our injection mold technique. If you want something that's maybe a little bit more easy to maintain and longer lasting, then we have the composite veneers. Composite veneers have been around for a long period of time, but the positioning tray that we use is an absolute game changer.
Yeah, the indirect approach.
Yeah, indirect approach. So it's going to be easy for you to get it done, right? All cases, no injection, no drilling. Think about that, right? So saving your tooth enamel, making sure that the health of your teeth is looked after, getting treated in an ethical way. And then if you want sort of the longest lasting thing and your budget allows, then you're going to go for porcelain, you're going to go for zirconia, whatever the ceramic material of choice is. That's just going to give you that polished smile for a longer lasting period of time. But there's something to suit everybody's budget. And again, putting choice back into the patient's hands backed up by sound evidence, ethical dentistry.
Yeah, conservative approach.
Yeah, conservative, exactly.
Yeah.
And for me, it's the stage just before that same day stage, and that is the trial smile, the mock-up, where you get to road test that, you get to see that, you get to try before you buy, where you actually see that design in your mouth. Because it's one thing looking at a photo, it's one thing me trying to sell it to you all day long and telling you how amazing it's going to look, but until it's in your mouth and you get to see it, film it, take a photo, show your loved one, get that seal of approval,
customize it,
change it if you need to, tweak it. Because we know then, with the predictable flows of digital dentistry, what we show you that day at the trial smile, that's what we're going to deliver to you on the final day. So there's no being disappointed. There's no, oh my God, what is it going to look like? There's no guesswork. We take that out and you'll get to see it and you get to try it. And once you've okayed it, we'll deliver it.
Absolutely. Couldn't have said it better, Will. So 2023 has come to an end, guys. I can't believe how fast it's all happened, but we've achieved what we set out to achieve. Couldn't be happier for the development of Save Day Smile. So over to 2024, more work, more courses, more invention, bigger community, bigger, better, bolder than ever before. And it's going to be a privilege. I'm really looking forward to 2024. We're bringing it home officially this time.
I can't wait to get started on it, to be fair. I think it's going to be a super exciting year. Again, the community is going to grow even more. And yeah, Same Day Smiles. It's going to be on everyone's tongue and hopefully in everyone's mouth.